The EMT checks that they have all the equipment necessary, including the oxygen tank, regulator, key, non-rebreather mask, and nasal cannula. The EMT ensures that there is no debris around the oxygen cylinder stem by cracking the tank and allowing oxygen to escape. The EMT does this by slowly turning the valve counterclockwise until a rush of air is heard. Then, turning the valve in the opposite direction to stop the flow. Make sure the tank is positioned away from the EMT and the patient. To assemble the regulator, the EMT places the O-ring around the gas outlet of the regulator. Then, the EMT locates the 2 pins on the regulator, which will be aligned with the matching pinholes on the oxygen tank. The T-handle on the regulator can be hand-tightened to secure the regulator to the oxygen tank. Then, the EMT opens the tank by turning the valve 1 full turn counterclockwise. The regulator gauge rises to the pressure in the tank. The EMT then attaches the oxygen tubing of the non-rebreather mask to the port on the regulator and turns the flow regulator to between 10 and 15 liters per minute. The EMT then depresses the one-way valve on the non-rebreather mask to inflate the reservoir bag. To secure the mask on the patient's face, the EMT will gently pull tight on the mask straps. If the patient's condition warrants a nasal cannula instead of a non-rebreather mask, apply the nasal cannula. Attach the oxygen tubing to the regulator and turn the flow regulator to between 2 and 6 liters per minute. The EMT places the nasal cannula prongs in the patient's nares and wraps the tubing around the patient's ears. To secure the tubing, the EMT cinches the tubing under the patient's chin. Following oxygen administration, the EMT must reassess and monitor the patient's condition. Thank you for reviewing this Falck Health Institute skill video. Please like and subscribe for future videos.